Okay, class, welcome back to another video on medical terminology. In this video, we are going to be looking at Chapter 6, which is the urinary system. So let's jump right in and get started. So the urinary system is made up of several different components, and we're starting on page 207, if you're following along in your textbook, which is Lafleur's Exploring Medical Language, 9th edition. You can see that right here. So page 207 is where Chapter 6 begins. We'll begin with just a quick anatomy overview and functional overview of the urinary system before we jump into the medical terminology aspect of it. The urinary system, as you can see here on the slides, of course, removes waste material from the body. So our kidneys are going to filter our blood, and then it's going to drain down into our bladder and then eventually out and be excreted from the body. And we'll look at that process in a little bit more detail. It's also responsible for regulating fluid volume in the body. So if someone is retaining fluid or dehydrated, either way, the urinary system is highly involved in doing that regulation. And the third item here on this list, maintaining electrolyte concentration, the kidneys specifically are going to be pulling out excess electrolytes that our body does not need and retaining those electrolytes that we are deficient in. And then the last item on the list, assisting in blood pressure regulation. And that goes along with the second item on the list here, regulating fluid volume as well, in that our blood pressure regulation is done in a large part by the fluid volume that's retained in the system. So if we flip the page and start looking at some of the actual organs of the urinary system, we'll see a couple of different images here that I'm going to scroll through, and we'll be coming back to look at these, but I just wanted to kind of show you where we're going. The main organs of the urinary system, and these are listed on page 208 of your text, looking at the kidneys, ureters, bladder, and urethra. And again, we'll look at this from an overview perspective, but then also look a little bit more closely at each one of these. The kidneys themselves secrete urine, as is listed here. It's collected via the renal pelvis before it passes on through the ureters and then finally eliminated out through the urethra in both the male and the female. So as we scroll through these next few slides and images, we'll see a little bit more detail on what that looks like and how that's done. So again, from a broad or an overview perspective, here we can see that the kidneys themselves drain, they're filtering blood up here in this top section of the kidneys. That's where we see our nephrons, the renal corpuscle, and then coming out through the renal pelvis in a section that's called the glomerulus. And then that drains through the renal pelvis, the urine, down through the ureters, into the bladder where it's stored before it's finally excreted through the urethra out the urinary meatus. And of course, that looks a little bit different for males than females, but overall the process and the pathway is the same. So here now we can see a little bit of a more detailed look at the kidneys themselves. And we can see up here at the top left, we have a left and a right kidney, one on each side of the body, protected slightly by the rib cage. But remember, this is that sort of subchondriac region that we learned about in Chapter 3 of this text. And then we can see the ureters coming down to the bladder. So this is the overview. If we blow that up a little bit and we look more closely, we see that within the kidney we have a section called the medulla or medulla, and we can see that down here being blown up even further, the medulla or medulla, and then the top section being the cortex and then lined with the capsule. So if we're looking here, we can see this whole section here. We would call this the medulla or medulla. And then the top section where we see all of these little arteries and veins sticking out, that's up into the cortex of the kidney. And then that outer band layer right there is the capsule. So let's take a little bit of a closer look at what each one of these medullas or medulla actually do. And we can come down here to this bottom image, and we can see a whole bunch of different anatomy that's listed here, and we're not going to get too deep into the weeds talking about anatomy here because that's not the purpose of this course. But I do want to point out the renal corpuscle. Here we can see the afferent arteries and the efferent arteries. as well as this proximal tube and the distal tubule coming off of the collecting duct. And so what happens is we've got the arteries and the veins coming up into the medulla or into the kidney themselves, and we can see up here on this full picture of the kidney, we've got the artery coming in, the vein coming out, and it goes through and it kind of wraps itself around in this network of capillaries. And inside those capillaries, as they get smaller and smaller, what we see is that the capillaries themselves then get surrounded by the proximal tubules. And the proximal tubules then surrounding the artery forms what we call the glomerulus. That's part of the renal corpuscle, as we can see here. And so that glomerulus is where the filtration is taking place. It's pulling out of the blood and doing the filtering that it needs to do. So whether it's pulling fluid out or working on that electrolyte balance that we were discussing previously, that's where that's all taking place. From there, passing through the tubules and then down through the collecting duct, and then all of these individually as they're each doing this. So you've got all of these in the medulla of the kidney, the entire nephron, you have all these nephrons that are then draining all of their urine, which is that excretory waste, into this collecting tube that we call the renal pelvis. Then the renal pelvis takes and drops that down into the ureter. And so then again, we can kind of go up to our larger gross anatomy view of that and see the renal pelvis coming out, formed into the ureter, and then that takes us back down to the bladder. And we can see that again here, same thing, we've got all these nephrons draining into the renal pelvis, down through the ureter, into the bladder, out through the urethra. So that's the essential anatomy of it. Now we've kind of already mentioned this and explained what the nephron is and what the renal pelvis is, but here it is on your screen in definition so that you can see exactly what that does. Interesting note about the nephron. Approximately 1 million nephrons located in each kidney. So if we look at this image again and we say, okay, well, hey, here's all these nephrons that are listed here, and this whole section is one nephron. The nephron's made up of the medulla or the medulla, the cortex, and the capsule. Inside of that, the renal corpuscle, glomerulus is inside of there. So there's 1 million of these nephrons that we see pictured here in each one of your kidneys. So lots of filtration going on a microscopic level. We mentioned the ureters, those two slender tubes coming down from the kidneys that carry the urine to the bladder. And then, of course, we've already looked at the bladder. We know that that holds the urine before it's excreted from the body. The urethra is what the urine passes out of on its way out of the body during excretion, and then the urinary meatus is the actual opening that the urine passes through on the outside. So think of the urethra as the conducting tubule from the bladder to the meatus, and the meatus is the actual opening moving outside of the body. And here we can see the difference between the male and the female system. Obviously, one main difference is the female has uterus, but that is not part of the urinary system. Just note that that is there. Also, the proximity of the uterus to the ureter and the urinary bladder. Now we can see the urinary bladder in the female is quite a bit smaller than the urinary bladder in the male. So I guess if we want to look at all kinds of stereotypes and females having to go to the bathroom more frequently, always having to stop on road trips, there is some science that is reasoning for that. So if you happen to be that female and you're getting some feedback about needing to use the washroom, you can pull science out and say, well, it is true, it is a fact that the female's urinary bladder is smaller than the male's. Additionally, if you happen to be pregnant, of course your uterus is going to have your baby growing inside of it, and that's going to, as it grows, put more pressure on your urinary bladder, which will, again, cause that to not hold as much urine, and is what we see the response for frequent urination with mothers that are expecting. Down to the urethra and the urinary meatus. Obviously, here's where we get to the external genitalia of the male and the female, and there's going to be obvious differences there. Of course, the male having the penis and the female having the vagina, which we will discuss in more detail when we get to both the male and female reproductive systems. But just note that there is a little bit of shared anatomy between the two systems, albeit is quite small. Here's a close-up and an exploded view of the urinary bladder. And this is the male's bladder. We can see that the prostate is down here over the urethra, and we'll discuss that a little bit later in this video. I'm not going to spend a whole lot of time here, just otherwise showing you the male bladder. All right, so if we jump forward a couple pages to page 212 in your text, here we see our first chart of words for this chapter, and we're looking at the combining forms that are used in the urinary system. So as we have come to be accustomed to, we see a lot of the combining vowel of O being used, and so we can look at some of these words like cysto or vesico. We know that cyst means bladder, vesic also sac, and so just adding the O to it, then we get the combining forms. We can say cysto or vesico. Glomerulo, for example, from the glomerulus. So that is listed there. That's how you would pronounce that, and that's the combining form. Meato, nephro, reno, as we move down this list, pyelo, uretero, and urethro. Don't need to spend too much more time on that list. Going to page 214, in the text we see some more of these combining forms commonly used. Take note of these as you move through them, but really nothing to spend a whole lot of time on here. I will make note of a few of these terms, such as the oligo. We'll mention that in terms of urine output, so oligo meaning scanty or few, and so when we say like oligouric, the uric meaning urine, oligo meaning scanty or few, so reduced or less than what we would expect output of urine on that patient. Some terms like litho, we've seen that with, we see that with kidney stones. So lith just meaning stone. Hydro, water, glyc for sugar, blast, developing cell, and azoto for urea, nitrogen. Some suffixes listed on page 215. Here we see like esis and iasis, meaning a condition, and we're starting to see this repeated from chapter to chapter. Lysis, meaning a loosening or a separation of. Ptosis, that P-T-O-S-I-S, the P is silent, so ptosis, meaning a drooping or a sagging, and can also mean a prolapse. The raphy or raphy, the R-R-H-A-P-H-Y. We're going to see that in multiple chapters and systems as well, referring to suturing or repairing surgically. Tripsy is a crushing or a surgical crushing. Trophy as it regards to nourishment in urea, as of course urine. The author does make note of these rhea or the RRH suffixes, so rhea, regia, and raphy. We can see which chapters that those are included in and what their meanings are as well. All right, so page 216, we are getting into the meat of the medical terminology section here, and so here we see diseases and disorder terms that are built from word parts. So here's some medical conditions actually built from word parts, and remember that's type 1 of medical term category all the way back in chapter 1. If you've not watched that video yet, please go back to the beginning of this list and look at the chapter 1 medical terminology video. So again, type 1 is the category that we're on here. We can actually look at these words and break them down based off of the word parts that they're made out of. So we don't have to just simply memorize the word like the type 2 category that we'll see, but we are able to break them down by the word types themselves. So a lot of these here, if you're working in healthcare, you're going to hear a lot of them frequently. If you're working for a urologist, you're going to see more of them more frequently. Otherwise, some of these we're not going to be saying all that often depending on where you're working. If you're not in the urology department, then you may not see some of these that frequently. You know, when we're talking about glomerulo, cystitis, azotemia, some of that stuff you're going to see all over the hospital or clinic area, but some items like cystolith, cystocele, hydronephrosis, nephritis, like you're not going to be using that frequently, but things like nephritis you are going to see just about day in and day out if you're working in a hospital or a clinic, because patients will have those things. So again, break these down, be cognitive of what the endings are. So here we like the itis for inflammation and cyst. Remember cyst meaning that sac or bladder. And so that just means an inflammation of the bladder. Cystocele, remember that cele ending, C-E-L-E, is a suffix that is meaning a protrusion. So cystocele, we've got a protrusion then of the bladder. And on through, we can start looking at multiple words combined with forms and then with the suffix of glomerulonephritis. So now we have inflammation of the glomeruli of the nephron. So you can put all of those together. We can see this chart is quite extensive on page 216 and then continues on to 217. I'm not going to go through each of these words, but those charts and the definitions are listed for you there as well. But look at how we're seeing some of these terms repeated. So we've got that ureterocele or uridocele. So we're using that cele again. If you've learned that suffix already, now all you have to understand is what is the word root that it's being added onto, and piece of cake. You don't have any problem memorizing these words or understanding them because you're starting to recycle them over and over. Same thing with like the ureteritis. We know what the itis means, pyelonephritis as well, pyelitis, and so on. Megaly meaning enlarged, and nephro, of course, meaning nephron. So we can put those together. So flip a couple pages over to page 220. In between those pages, you've got some of the exercises in your text in order to split those words up and understand their meaning. So I recommend and encourage you guys to go through that. But if we look on page 220 and page 221, then we're looking at disease and disorder terms that are not built from word parts. So this is that type 2 category from chapter 1 that we learned about. And here we're just going to have to memorize these words. And as customary, I'm not going to go through every individual word that's on here. Some of them are pretty straightforward, such as renal failure. Well, that's the failure of the kidneys or the renal system. Hypertension, we know that that's high blood pressure. And so if we have renal hypertension, that's high blood pressure within the renal or the kidney system. And then some other terms like urinary retention is fairly commonplace. You're retaining urine. Okay, so nothing really too difficult about that. Looking at some of these words up at the very top, such as the epispadias or the hypospadias, now we're starting to look at some different words where you're just going to have to memorize what those meanings are in order to understand that. If you're not using these terms regularly, as I've mentioned before, you're going to forget those fairly quickly. So it really does matter if you're using them on a day-to-day basis or not in your practice. And if you're not, you probably don't need to know what the terms are all of the time. And when you see it and you do need to figure it out, then you can quickly look it up and you'll have the knowledge to be able to understand what that term is, even if you don't have it memorized. Down here at the very bottom of the slide, we see urinary tract infection. And it is abbreviated UTI. We'll see that at the end as well on our abbreviation slide. This is so common that we, in the medical profession, will just call a urinary tract infection a UTI. So you're going to hear that a lot. Here we see what a urinary tract infection looks like after a resected bladder is being examined and photographed for your learning. So here we see a cystitis. Remember, itis, inflammation, cyst meaning bladder. And so cystitis literally just showing us that we've got that inflammation of the bladder. And you can see how reddened and dark that interior of the bladder happens to be. So after they dissected this bladder, you could see how much inflammation is going on inside of it. It should all look like this nice sort of peach color, but instead you have this really dark blood red color. That's inflammation, and that should not be there. That inflammation in this case is being caused by the infection. And so we have the urinary tract infection, specifically in this case, the bladder infection or the cystitis. I want to make one more note about page 221 before we move on. Table 6-1 there for renal failure lists a couple of abbreviations that we're also going to see at the end for acute renal failure, chronic kidney disease, and end-stage renal disease. So ARF for acute renal failure, CKD for chronic kidney disease, and ESRD for end-stage renal disease. And it gives you definitions of that on page 221. We'll look at those abbreviations again at the end or towards the end of this video. So skip over then to page 223, and now we're looking at surgical terms built from word parts. So again, type 1 category, but these are specific to surgical terms. And what we continue to see and will continue to see are these very precise surgical suffixes. So the ectomy, the otomies, the raphes, the tomies, the tripses, we're going to continue to see those throughout. So cystectomy is the excision of the bladder, bringing that bladder out. So anytime you see that ectomy, that's removing something. The tomy, like cystolithotomy, or tomy there, lithotomy, we are seeing that that is an incision or a cut into the bladder. So anytime you see otomy, that's that cut into it. Raphe, we've already mentioned in this video, as being a suturing. Cystostomy, anytime you see ostomy, that's an artificial opening that's being created into that part of the body. So in a cystotomy, we're talking about the bladder. If we were talking about a tracheotomy, we would be talking about, remember from chapter 5, the respiratory system, the trachea, and cutting a hole into the trachea so that that respiratory patient would be able to breathe, and so on and so forth. You guys can look at the rest of those terms and see the definitions from there. We see that this list is a little bit longer as well, as we see it being continued on to page 224. Some surgical terms that are not built from word parts, we've got to skip over to page 228 to see those. Here again, you're just going to have to know these words or memorize these words. So the extracorporeal shock wave lithotripsy, or the ESWL, using a shock wave in order to break up those kidney stones. And so that's what that is ultimately referring to. The fulguration is just a destruction of living tissue using an electronic spark. And renal transplant would be transplanting a kidney. Some terms for diagnostic imaging in the medical profession. You're looking at some type of acute broad view assessment. So the patient might come in with some type of sign or symptom. The provider's going to evaluate and assess the patient and come up with a preliminary diagnosis. That preliminary diagnosis will require further investigation and further laboratory assessment in order to confirm the diagnosis. Sometimes that is done with laboratory testing, like I just mentioned. Other times it can be other types of diagnostic imaging, such as scans, x-rays, or other types of imaging to go along with that. So on page 231, you can see a handful of those different types of diagnostic imaging tests that we just were talking about. And it does provide a couple pictures for you of some different types of things, like such as a cystogram or a urogram on page 231 as well, so that you can look at that. The next couple pages show you some other scans, some CTs or x-ray of different portions of the urinary system. Here's an example of the nephrotomogram as well as a renogram. We won't spend much time here, but essentially a CT or X-ray type of visualization of what's going on inside of the urinary system. Most cases, the kidneys or the bladder and the ureters. Here we see some of those other scopic or scopic terms that we discussed. Here is a picture of the cystoscope going into the bladder. So cyst, again, bladder, and scope. This is on a male, as you can see here. Going in to inspect the bladder. Some diagnostic terms that are not built from word parts, we see those listed on page 235. KUB is just another abbreviation listed there. You can see for kidney, ureter, and bladder. So common to group all of those together and just and talk about a KUB in the medical terminology. Some laboratory words such as BUN, or blood urea nitrogen, creatinine, specific gravity urinalysis, all very common laboratory tests that will be done in order to help diagnose a patient's urinary system. We see this a lot with patients that have failing kidneys due to disease or abuse, as well as with infections. We will start seeing all of these done on a fairly regular basis. Some of the complementary terms that are built from word parts here on page 238. Pretty extensive list here, so again, we're not going to go through all of these, but note, like over here on the right-hand side, oliguria. We mentioned that before, that oligo meaning scanty and urea meaning urine, so scanty urine or less urine output. Nocturia, again, uria meaning urine, noct meaning night, so urination at the night. Polyuria, poly meaning multiple, and so excessive in this case, excessive uria. And we can see urologist, urology, again, those who study and the study of the urinary system. Similarly, dysuria over here, same as polyuria or oliguria, but dysuria means difficulty or problems with the urination, so difficult or painful urination. Hematuria, hemat, as far as blood is concerned, albumin, proteins, albumin inside the urea. Anuric or anuric, so again, A or an meaning no or lack of urea. Moving over to the chart on page 241, now we have the complementary terms that are not built from word parts. Here we see things like the catheter that's going to be placed inside of our patients if they're having problems voiding their urine. A catheter will be placed through the urethra into the bladder in order to drain that. A term like distended, like a distended bladder, meaning the bladder is not draining, so it's distended. It's essentially being stretched out. Electrolytes we talked about previously in terms of the kidney's role in filtering those things out. Of course, we know the electrolytes being like sodium, potassium, magnesium, and so on. All right, I want to show you the image of this hemodialysis. Figure 619 there on page 242 shows us this young man connected to a hemodialysis unit. And you can see there with the tubing, one tube is bringing the blood out, and then it's being filtered, and then it's coming back into and being placed back inside of the patient after it's been filtered. And then what was filtered out will be discarded. And then that allows the patient's blood then to essentially be normal and being filtered after what the kidneys are no longer able to do would have been taken place. Now this image down here below that, figure 620, is explaining peritoneal dialysis. And with peritoneal dialysis, you can see this little catheter running through the top of the stomach right up here, and then that's being placed down into the peritoneum of this patient. And with peritoneal dialysis, essentially what they do is they put in a dialyzing fluid into that catheter and pump the abdomen up with that dialyzing fluid. That fluid then essentially is like acting like a sponge and soaking up the electrolytes and what is not being able to be filtered because of the poor functioning kidneys. And then after usually a couple of days, that water will be drained, that dialyzing fluid will be drained, and along with it, all of the electrolytes and other waste materials that the kidneys are not getting rid of. They'll put that fluid back into the peritoneum and allow it to continue to do its work. And so that's called peritoneal dialysis. Now the kidneys do their own dialysis. That's what they're there naturally to do, but when they start failing, either again from disease or from abuse, then that's when we have to do that as the medical providers, filter that blood for the patient. A term like incontinence, you've probably heard that before. It's just meaning where you do not have control of your bladder or your urinary functions. And so this is typically what we see with elderly patients who lose the control of that function and end up having to wear like the adult diapers in order to not soil their clothes. And so that is pretty common as we continue to age. Here we see on page 245 just this final list of abbreviations and some of the ones that we've already looked at and mentioned before. Again, note the ARF, acute renal failure, BUN, blood urea nitrogen, cath for catheter, CKD, chronic kidney disease, ESRD, end-stage renal disease, and so on. If we go to the other side of the list, we see urinary analysis, UA, UTI for urinary tract infection. All right, that completes our look at Chapter 6 of the urinary system. Have a great day, and thank you for joining me for medical terminology.